Hi guys, so today's short video is the first of the sciatica series, and it'll illustrate how trigger points in the gluteal muscles, so Maximus, Medius and Minimus, present, and how, as the name suggests, these trigger points may mimic sciatica symptoms. Now, a lot of people struggle with lower back, hip, leg pain, and may naturally assume the worst. So often when clients approach me, especially with pain in the lower back and hips, they're concerned with the bony structures in the joints, and perhaps don't take the trigger points into account, which is understandable. You're not naturally going to assume that the pain you're feeling is coming from muscle that's several inches away. So let's take a look at the anatomy of all three of the gluteal muscles in a bit more detail, whilst also highlighting where the trigger points commonly lie, and crucially how their pain patterns present.
Okay, so gluteus minimus, we just strip away gluteus maximus, medius, and also TFL, iliotibial band, we can now see gluteus minimus sort of tucks in underneath gluteus medius, and just in that little sulcus at the back of the ilium, and again inserts on the greater trochanter of the femur. Here we can see the trigger points in the smallest of our three muscles actually has the capacity to refer pain the furthest. So these first two triggers are located anteriorly, so towards the front of the muscle. Interestingly, don't actually generate pain in the muscle itself, but rather the bulk of the posterior glutes towards the sacral border, and down the lateral border of the thigh and the lower leg. So the next bunch of three triggers lay superiorly at the top of the muscle and do refer pain within the muscle as well as towards the sacral border and distally into the thigh and lower leg, although this time the referral is down the posteromedial portion of the thigh, so the back of the thigh, and towards the midline, as well as referring below the knee into the posterior calf, especially medially. Okay, so moving on to gluteus medius, we can start by just stripping away gluteus maximus, overlies it slightly, and as you can see, gluteus medius just sits inside that pelvic rim there rather nicely and inserts just at the top of that greater trochanter of the femur. And as the name suggests, gluteus medius in size is between gluteus maximus and gluteus minimus. There are three main predictable trigger points in gluteus medius, which are conveniently located at the anterior, middle and posterior aspects of the superior fibres just below the pelvic rim. So we're beginning with the posterior trigger, rather like the double trigger found in gluteus minimus, does not actually refer pain within the muscle, but rather up into the lower back, just superior and medial to the pelvis, and tracking down over the sacrum and into the bulk and belly of the glutes. So next we have the middle trigger, which refers a fair amount of pain into the posterior aspect of gluteus medius and also into the belly of the glutes and the deep six, like the posterior trigger. However, this point does refer slightly below the glutes into the hamstrings and also in and around the femoral head and the hip joint. So finally, the anterior trigger refers posteriorly, as we can see, and follows the pelvic rim around the sacrum and down almost to the coccyx, but does not refer below the glutes. Okay, if we start by looking at the anatomy of gluteus maximus, so as the name suggests, it's the largest of the gluteal muscles. If we highlight it here, you can see that it originates just that posterior aspect of the ilium, so the Mickey Mouse ears of the hips, I like to call them, and then also just the edge of the sacrum, and then it inserts two parts. The top bit, as I've said in previous videos, it's continuous with that iliotibial band here, and the more distal fibres, you can see it actually blends in just the side of the femur. That there is gluteus maximus. Okay, so in gluteus maximus, like gluteus medius, there are three main triggers, and they're located close to the midline, with two being distal and close to the region of the hamstring insertion, and the other being quite proximal towards bony prominence called the posterior superior iliac spine, or the PSIS. So the two distal triggers are in almost identical locations. So we go between the two there, and they both refer pain in and around the point of the trigger. This particular one that's on screen now refers very locally and in a C-shaped pattern around the trigger, whereas this next trigger, as well as sensitizing locally, also actually refers well away from the site, up into the PSIS that I mentioned, and almost the site of the other more superiorly located trigger point that we'll refer to in a minute. Furthermore, this trigger also refers to superior aspects of the iliotibial band and the gluteus medius. So finally, that superior trigger point refers all the way down the sacral border and again into the region of the proximal hamstring and below.